Conservative leader Pierre Poilievre says the government should have acted far earlier to clamp down on fentanyl. Poilievre says the federal government shouldn't have waited in appointing a fentanyl czar, stating the deaths of 50,000 Canadians from the drug should have been reason enough. He's also proposing life sentences for anyone convicted of trafficking fentanyl.
It should not take a foreign leader to get the Liberals to wake up to the drug crisis that they have caused here at home. 40 milligrams is enough to kill 20 people. Anyone who is involved in trafficking that amount of fentanyl will get a life sentence. We will lock them up and we will throw away the key.
How realistic is this? Leslie McBain is the co-founder of the advocacy group Moms Stop the Harm. She joins us tonight from Pender Island, British Columbia. And Leslie, do you think Pierre Poilievre's proposal could be an effective way of lowering the number of drug-related deaths in our country?
No, in a word. It will not work. It has never worked to, as we always say, you can't police your way out of a toxic drug crisis. His statement there has several flaws. One is that he's talking about 40 milligrams of fentanyl, which is a very, very tiny amount. He's also talking, I think, about kingpins. He's going to get the kingpins. Well, the kingpins aren't the ones that are out and about. It's the traffickers. And they would, it won't work. It won't stop the deaths. Fentanyl will still be manufactured and be on the toxic black market. And so his ideas simply won't work.
How about the measures being implemented along our border to stop the flow of fentanyl into the U.S. now? Do you think that's going to have any impact on our drug supply here in Canada?
No, I don't think it will have any impact at all. The amount of drugs that are trafficked across the border is, again, it's very small. It will have absolutely, to have any impact, it would have to be much greater amounts that are coming across the border. And all the evidence shows that there's just a tiny amount. So I think really it's political, and it's trying to, it's a fear move on the part of both governments.
So you don't see this as an appropriate way to tackle this issue. What, from your experience in battling this, what are some of the suggestions you think that our leaders should be following?
Well, the evidence, for one thing, and the evidence is that people who are using toxic drugs from the black market have no alternative. People who are living with addiction, living with substance use disorder, as we call it, it's a health issue. And those people need the support of implementation of prescribed alternatives, of certainly more low barrier evidence-based recovery programs. There are many things that can be done to stop the deaths. Taking the market away from organized crime by supplying drugs is one way to do it.
We saw some new numbers out of your province, BC, indicating that the province saw the lowest annual death toll from the drug toxicity crisis in 4 years, but you say that's not a reason to celebrate. Why is that then?
Well, of course, we're glad that there are fewer deaths.
Yes.
I mean, there's no question. We're glad about that.
Yeah, that's a given.
That's a given. And celebrating, or at least even being glad about it, doesn't take away the issue of the fact that 22,053 people did die, and they died of toxic drugs. And they're dying essentially because governments across the board, the provincial and federal governments, are not implementing the evidence-based solutions. The reduction in numbers of deaths could be, we don't know. Nobody actually knows why, but the conjecture is that there's a shifting drug supply. People who use these drugs are perhaps using in a safer way, with a buddy, with more naloxone. It could be that
could be the reason, you think?
It could be. We don't know. Nobody's actually being able to quantify that. What or qualify that. What is the reason for fewer deaths? There could be many reasons of which we just don't know for sure.
The tide is turning a little bit, you see, especially how politicians are approaching this issue. They're closing safe injection sites here in Ontario, or similar things are happening out in BC with different regions. What do you think about this right now? Because there are two sides to this, and some people say, well, a safe injection site, you're actually enabling drug use. You're not helping people to get off of it. What's your point to that criticism? What would you say to somebody who's saying that you're actually enabling them by having these sites available?
People who use drugs are going to use them anyway. So if we don't provide a safe consumption site, there's more chance of them dying. We will have more deaths with the closure of overdose prevention sites, safe consumption sites. It is not enabling. Like I say, those people will use drugs anyway, and they will be hidden, and they won't be able to be revived if they get the bad drugs. So it's not no, that won't work. That won't reduce the deaths. That will increase the deaths.
Leslie McBain is the co-founder of Canadian advocacy group Moms Stop the Harm, and she joined us tonight live from Pender Island, BC. We appreciate your perspective on this. Thank you for sharing it with us.
Thank you, Dwight.